When the COVID pandemic hit Mount Vernon Neighborhood Health Center, it hit us hard, and it came out of nowhere. Employees were infected. We lost 3 longtime employees to this pandemic, 3 longtime employees who our patients adored, we lost to this pandemic. The senior management team, myself, and beginning with myself, contracted COVID and ended up having to be furloughed. So the entire leadership team, because we had been meeting daily having daily briefings about this disease that no one knew that much about, that sort of hit us by storm. And so we all had to be furloughed. So we had to adjust to working remotely, virtually, meeting, and running the operation remotely. And our Mount Vernon site in particular is located within close proximity to New Rochelle, where this whole thing began, right? So we got hit really hard in Mount Vernon. And so as a result of a lockdown, we saw a significant reduction in our patient visits, right? But at the same time, we had new patients coming because Mount Vernon Neighborhood Health Center remained open and accessible. But many other facilities had closed down and people had no place to go, so they ended up coming to our Mount Vernon site, any one of our sites, Mount Vernon, Greenberg, or Yonkers in particular. The school-based health centers, of course, closed, but our other sites remained open and accessible. In collaboration with the governor's office, we established a walk-up COVID testing facility in Mount Vernon because, as you know, there were drive-up facilities. And many of the folks who come to the health center, our patients are significantly, disproportionately impacted by COVID-19. They're primarily black and brown people. They don't drive, many of them. They use public transportation. As you know, there was no public transportation. And the COVID testing facilities were primarily drive-up facilities. And so we opened up and erected one of the first COVID walk-up testing facilities in the county of Westchester. And that testing facility is operational today. And it's comprised of tents at our Mount Vernon Health Center location. And one needs only to call the New York State hotline to either schedule an appointment or to walk in. And we've seen those numbers go from April 17th when it opened. We've seen those numbers go from 30 to 40 people a day to upwards of 300 per day being tested. And let me say, there's no funding that's available for that testing facility. New York State and the governor's office provides the PPE and the tents, but it is Mount Vernon Neighborhood Health Center who is required to staff that. We had less revenue coming in, right? So no patients equals no revenue or very little revenue, right? And so it impacted us significantly so in a negative way as a result of the pandemic. So the health centers have been in existence for about 50 years. Close to 50 years we've been in existence, and we're the safety net provider within the community. We don't turn anyone away based on ability to pay or immigration status. That's one of the rules that comes with the designation federally qualified community health center. And what it means is we get money from the federal government primarily in order to operate. So we're the safety net provider in the community. We've always been here for the community for, again, close to 50 years. We're here in the community. We're the trusted source for health care to the community who are suffering disproportionately by COVID, right? And so we are positioned to vaccinate the population who needs it the most. We've received a small amount, and we began to start vaccinating our staff and some of our patients. We obviously need much, much more in order to meet the needs of our population. So we have waiting lists of thousands of patients who are waiting for the vaccine, but as you know, it's coming out. It's coming very slowly. We have about 20,000 registered patients, 70+ thousand annual patient visits. 50% of those folks are uninsured. Many more are undocumented. They have no place else to go. This is where they come. And if we don't take care of them, they're going to go out in the community and they're going to make everyone sick, right? Now, it's very expensive to take care of this population because they are riddled disproportionately with everything from diabetes to high blood pressure to depression to asthma, cancer, Black and brown people, I think most people know, are disproportionately impacted with these illnesses. And so if they can't come here, where will they go? They have no place else to go. And these aren't folks of means. These aren't people of means, so they don't have a lot of money. So we're always seeking assistance with funding. We get a modest amount of money from the federal government. We write grants, we fundraise, we do what we can, but obviously it's never enough. And in particular now, in the middle of a pandemic, when people are losing their insurance, we're seeing lots more patients now because people are uninsured. So they think, okay, we're going to go to the health center because no one else is going to see you. Think about it. When you go to the doctor, the first thing they ask you is, do you still have the same insurance? That doesn't happen here. We're going to see you regardless of insurance status. The population who are predominantly served by the health centers are disproportionately impacted with every illness that you can think about. And COVID is no different. The black and brown people are dying disproportionately from it. And so if not here, then where? This is their home.